Benjamin, from what I was hearing, the good doctor had some very sensible commentary that I just wish our government could listen to. So she said, it's fast transmitting. There are some things that you can and should do to stop its spread, i.e. big events. So anything above 2,500 people, you should be thinking about whether or not it's sensible to do. You should be more stringent on face mask wearing, and you really should be rolling out the vaccines, which we are doing. So that's one bit of the advice that we're doing. But she was very clear, saying that 9 out of 10 people who are in ICU have not been vaccinated. To my mind, that's the best stat. You put the stat out there and then let people make their own minds up as to whether they should be vaccinated. I don't know what our government's doing.
Well, I mean, hang on. It's fine to say you put that out there and then let unvaccinated make the choice. But I think a year into the vaccine rollout, what is the reason why the sort of 12% of adults who haven't had any doses of the vaccine still haven't got it? But
it's up to them. You cannot and should not want to live in a country where that is forced.
Do you know, I don't want to live in a country where a tiny irresponsible minority cause the whole country to potentially be shut down because they're flooding our hospitals and overwhelming the NHS. So that's what I think is wrong.
So what do you... Okay, so the 12% who refuse to take the vaccine, what would you describe them as?
Well, I mean, they're irresponsible and selfish, and that's evident. You know, I think in our hospitals about...
But do you think it's right, though, to say to somebody, because they've chosen not to do it, because it's not risk-free, and I'm not defending them, but it's not risk-free, and would you not want to live in a country where at least we have the freedom of choice? Because there are countries who have forced vaccines and vaccinations on their populations, and then we found out that it wasn't quite as healthy as maybe it should have been. And I want people to be able to make up their own minds about it. And I know, and I concur with you that it makes no sense to me that people wouldn't want the vaccine. But on the other hand, I respect somebody's right to make that choice for themselves.
But look, you know, half of our ICU beds that have COVID patients are unvaccinated. The doctor said it's about 9 and 10 in South Africa. You know, in some places here it's 8 and 10. And
when they do what Singapore does.
Well,
have you heard what Singapore?
Is that charging them?
So Singapore have now said if you have turned down a government-sponsored vaccine, which is free, if you then turn up in ICU or in hospital, you will pay.
I wouldn't do that because on principle I think everyone should have the same access to healthcare, you know, whether they're a smoker, a heavy drinker, or they refuse the vaccine. But what I have a problem with is the idea that there are people who have not done their bit that is so easy just to get the jab that the rest of us have had and taken responsibility, and now the whole country could be locked down because our hospitals have been overwhelmed with people who chose to refuse the vaccine. So as far as I'm concerned, there should be a lockdown for the unvaccinated because they're the people that are going to burden the NHS.
Okay, maybe you agree or disagree with Benjamin.